as the pricing will be moved out of NDIA to Independent Health and Aged Pricing Authority, probably that will bring in a third-party lens on looking at, and then probably there will be benchmarks comparing NDI's pricing within the aged care and the broader health system.
Yeah.
Looking forward to see what comes out of that. I wanted to, because you have so large number of cell accommodation, and how does supported decision making play within the scope lived experience?
Yeah, it's really important. It's really important that people with a disability have a say in how they live their life and what sort of support they get, by who and when. It's really important. The rest of the country can do that, and they should be able to do that as well. So it's really important, and we need to be really clear that we've got training and mechanisms in place to ensure that our clients are truly getting that, and that the investment at our frontline needs to be significant in terms of training and supervision and equipping our people at the front line to best enable that with all the people we support.
There's a very colloquial term in Australia we use, "Are we there yet?" And talking about a journey, and
No.
and partly, the journey is for the disability sector. We have been through a lot. People with disabilities, their families, carers, and the rest of Australia is also coming along on that journey. And if I have to pose this rhetorical question to you, which is, are we there yet on a journey to inclusive and fairer Australia? What would your response be?
Sometimes I think it's still harder for people with a disability to access all the things that everybody else can and take for granted. Tickets to an event for people who need wheelchair accessibility are really problematic. The rest of us can queue online, as frustrating as that may or may not be. For people with a disability through one of the larger ticket providers, they must submit a form and wait for somebody to call them back, and you have no control about when that is. And that's really demeaning, and it really puts people at a disadvantage. Access into buildings is still hard sometimes. Public transport is still hard. It's a lot better than what it was. We are on a journey, there's no doubt about that. But people who are wheelchair dependent still need to plan a journey depending on where accessibility can be obtained. So it's not as easy as what it is for everybody else. I think people that are non-verbal and are not able to advocate for themselves have a harder time accessing anything, and in particular accessing healthcare services. We do a lot of work in terms of working with government bodies and other organisations around accessibility and communication, and we've got some great projects through our CIRC, the division of our business, that is going a long way to improving communication access for people, but we've still got a long way to go.
Thank you, Lisa. Thanks for sharing views.
That's fine. My pleasure.